Hello friends, welcome back to Al Huda Health Trip. In today's video, we will talk about cardiac catheterization (EI). What is cardiac catheterization? Complication, post-catheterization, best country for catheterization. Cardiac catheterization, also known as catheterization or cardiac cath, is a medical procedure used to diagnose and treat various heart conditions. During cardiac catheterization, a thin, flexible tube called a catheter is inserted into a blood vessel, typically in the groin or wrist, and guided through the blood vessels to the heart. Catheterization is used for diagnosis and coronary angiography. Cardiac catheterization is primarily a diagnostic tool. It allows cardiologists to obtain detailed information about the heart's structure and function. Common diagnostic uses include assessing the extent and location of blockages in coronary arteries, measuring pressures within the heart's chambers, and evaluating heart valve function. Coronary angiography is a specific type of cardiac catheterization used to visualize the coronary arteries that supply blood to the heart muscle. A contrast dye is injected through the catheter, and X-ray images, angiograms, are taken to identify blockages or narrowings in the coronary arteries. In some cases, cardiac catheterization can also be used for angioplasty. A balloon-tipped catheter may be used to inflate and open narrowed coronary arteries, often followed by the placement of a stent to keep the artery open. It's also in valvuloplasty. A catheter can be used to repair or replace heart valves by inflating a balloon in the narrowed valve or deploying a new valve. Cardiac catheterization is typically performed in a specialized cardiac catheterization laboratory, cath lab, by a team of cardiologists and trained healthcare professionals. The procedure is done under local anesthesia, and patients are usually awake but sedated to ensure comfort. Cardiac catheterization is a valuable tool in diagnosing and treating heart-related conditions, and it plays a crucial role in the management of heart disease. However, it's essential to discuss the risks, benefits, and alternatives with your healthcare provider before undergoing the procedure. Cardiac catheterization is generally considered a safe and well-established medical procedure. However, like any medical intervention, it carries some risks, and complications can occur. Here are some potential complications after cardiac catheterization. Post-catheterization complications. The patient may face below complication after catheterization, such as bleeding or hematoma, infection, allergic reaction, kidney damage, blood clot, cardiac complications, arterial dissection, stroke, and pseudoaneurysm. However, these complications are rare of rarest. It's important to note that the risk of these complications varies from person to person and depends on factors such as overall health, underlying medical conditions, and the specific details of the procedure. Cardiologists and medical teams take numerous precautions to minimize these risks during cardiac catheterization. Patients are carefully monitored, and the benefits of the procedure are weighed against the potential risks. Before undergoing cardiac catheterization, patients should have a thorough discussion with their healthcare provider to understand the procedure, potential risks, and any alternative diagnostic or treatment options. Additionally, patients should follow post-procedure instructions carefully to reduce the risk of complications and seek immediate medical attention if they experience any unusual symptoms or signs of complications. When choosing a country for cardiac catheterization, it's essential to consider factors like your specific medical condition, the reputation of the hospital or healthcare facility, the expertise of the medical team, the cost of the procedure, travel logistics, and any language barriers. Additionally, consult with your healthcare provider for personalized recommendations and discuss the potential benefits and risks associated with receiving medical care abroad.